citizens of the world. Today I want to talk to you about two cases of the coronavirus being spread by asymptomatic carriers. I want to talk about this due to the current situation in the Netherlands. A woman from Amsterdam and a man from Tilburg have recently been tested positive for COVID-19. The woman from Amsterdam has been at a primary school to check children for lice, and she has been at the hospital where she works, but she was still asymptomatic. The man from Tilburg celebrated Carnival at apparently multiple places while still being asymptomatic. The Dutch government is saying that people don't have to be worried because, according to them, asymptomatic transmissions do not happen. I have two stories to prove them wrong. I'm going to start with the story about a British so-called super spreader. From January 20th till January 23rd, a British businessman attended Surfomax gas conference in Singapore. He then traveled to France directly from Singapore and stayed at ski resort Contaminet from January 24th till January 28th. While there, he didn't show any symptoms of the coronavirus. On January 28th, he returned to Britain. On the 2nd of February, he contacted Public Health England on learning he had been exposed to a confirmed coronavirus case at the conference in Singapore. On February 6th, he was quarantined in an isolated room at Guy's Hospital in London. On February 7th, 5 Brits tested positive for the coronavirus at the chalet at ski resort Contaminet. At a neighboring apartment, 6 people were admitted to the hospital for observation. On February 8th, Spanish authorities revealed a family of 4 Brits who were being tested for the coronavirus when they returned from France, where they say they were in contact with a suspected coronavirus case. The end result? 11 infected by one single asymptomatic carrier of COVID-19. The second story is one from China. A 20-year-old woman from Wuhan traveled 675 kilometers north to Anyang on January 10th, where she infected 5 relatives without ever showing any signs of infection. Anyang did not have any cases before she traveled there from the epicenter of the outbreak. When her relatives started feeling sick, doctors immediately isolated the woman and tested her for the coronavirus. Initially, the 20-year-old tested negative for the virus. A second test came back positive. On February 11th, all of her 5 relatives developed COVID pneumonia, while the woman from Wuhan still had not developed any symptoms. Dr. William Schaffner, an infectious disease expert at Vanderbilt University Medical Center, says scientists have been asking if you can have this infection and not be ill. The answer is apparently yes. For the ones who still don't believe me, I have put links in the description so you can read about it yourselves. At the time of recording, there are 7 confirmed coronavirus cases in the Netherlands. Reporting to you from Amsterdam. Give this video a thumbs up, subscribe to the channel, stay safe, and see you next time.